Despite the distinguished history that medical ethics has enjoyed, dating from the days of Hippocrates in ancient Greece, traditional codes and practices of medical ethics proved to be inadequate to address a great many problems arising from modern medicine and scientific research. This history is particularly disappointing from the perspective of contemporary concerns about the rights of patients and research subjects to decide what will happen to them. These rights are their autonomy rights. The Hippocratic Oath failed to address fundamental issues of physician responsibility to tell the truth to patients, to disclose diagnostic and prognostic information, and to allow patients to make the final decision about what will happen to them. However, in the last 40 or 50 years, it's come to be appreciated that protection of the autonomy of patients and showing respect for their autonomy is a very special value, but one that has often been abused in the history of medicine and research. A compelling example has recently been told in a well-known book by Rebecca Skloot entitled The Immortal Life of Henrietta Lacks. Mrs. Lacks, as she was addressed at the time, was a patient at the Johns Hopkins Hospital in Baltimore. Every single one of you involved in this course on bioethics has benefited from research on Henrietta Lacks because her cells became basic for many forms of biomedical research. However, the cells that were clipped from her body were taken without her knowledge or consent. Mrs. Lacks was never informed about anything that was being done with her cells, nor was her family ever notified or consulted. Mrs. Lacks, being what was classified at the time as a colored woman, was assigned to a segregated ward in the hospital, in itself a deep offense to respect for her as a person. This does not mean that she was given inferior medical treatment at Johns Hopkins. The facts suggest otherwise. She was given excellent medical treatment. But the facts also suggest that she was not given anything like the best ethical treatment as a patient or as a research subject, which she didn't even know she was. She was not told anything, and the family did not learn what had happened until 20 years later, when they learned almost by accident. This 20-year period was roughly between 1950 and 1970. These years were a disgraceful period all over the world in the medical treatment of and research on patients and subjects of experimentation when it came to consent and those kinds of issues of autonomy. The atrociousness of experiments in Nazi Germany are well known by everyone. Less well known are the many abuses at the same time that occurred in the United States and many other countries. The takeaway lesson here is that the dignity, autonomy, and rights of patients and subjects have often been abused in the history of medicine and research, and we are still coming to grips with how physicians and research investigators must treat patients so that their autonomy rights are respected and not abused.